Sorry, you're all going to have to unmute yourselves and put cameras back on.
That's fine. Thank you, Josh. Next slide, please. So firstly, just to give you a bit of a heads up of the work that's been ongoing and the timelines. So in May, so more recently, we've improved the one-time link, which is the preferred option by many patients for managing their deliveries. And we will walk you through that this afternoon. And we've also introduced live delivery tracking via SMS. So that's gone live. And again, this is something that we're all very familiar with in our own personal lives around managing deliveries to our homes or designated addresses. In September, we've conducted a soft launch of the patient portal and My HealthNet app. So again, enhancing those and making the user experience better. And we've been introducing the messaging channel improvements, again, in improving incoming communication from patients into HealthNet. Moving forward into the last few months of the year, we continue to be very busy. There will be customer services improvements, which we will walk you through, and some really exciting developments that we're bringing into HealthNet. In November, we will have a computer system upgrade, which I know the NHS have experienced previously with other providers, but we will hopefully reassure you with how we've been conducting that and the whole project that we've been managing over a number of months already at HealthNet. I'm sure the big topic will be all the enhancements that are going into the clinician's gateway to improve your experience and the functionality of that to make it more efficient and easier to use. And then latterly, we will be sharing with you the bulk uploading of prescriptions and processing of prescriptions. So that has been a real topic of discussion, probably with us for the last 18 months. So a lot to get to sort of share with you, but hopefully you will see that we've listened to you and we've really been driving these developments and managing these projects for the best part of this year and at the end of last year as well. So at this point, I'm going to hand over to, I think it's Josh, so he can start sharing with you the patient digital options that we have available.
Thank you very much, Sam. And thank you to you all for joining. Just to reiterate what Sam said, I would encourage you to put any questions into the chat. You may have someone responding to those questions as we go. If not, we will get to them either at the end or in a written response afterwards. So first and foremost, we'll be covering the patient-facing tools. So we'll be talking about what the tools used to look like, what they look like now, and what they're going to look like moving forwards. So on the screen, I've put a screenshot of a couple of our legacy tools, so the patient one-time link and patient portal. Now, this is something that many of you might not have seen because they are patient-facing, but this is kind of just to set the scene. So you've got a comparison point into the tools as they are changing. So the first thing that's changed in May this year was the one-time link. So we've invested majorly in our patient-facing digital tools this year. I can see that a couple of the images are a bit pixelated. I think there's something happening with the sharing, but hopefully you can see the content as it's needed. So the most popular digital tool that we have, the one-time link, had its revamp first of all and went into production in May this year. And since that launch, 110,000 deliveries have been successfully arranged through the platform. Now, when we were designing these changes to the patient-facing tools, the thing that was first and foremost and kind of upfront in our minds was making sure that all of these tools were completely self-guidable and discoverable. So what I've put on the screen is a typical flow that a patient would see when they go to confirm a delivery with us through the one-time link. So the thing that I've not included on the screen is how they validate themselves. They put in a date of birth and a postcode, and then they go to the items that are available for dispatch to them on that delivery, and any additional items that might be able to be added, such as needles, bins, swabs, etc. Then they go to confirm their delivery address and instructions. You can see this is step by step, and there's a stepper at the top that confirms that process. They can change their entrance location, so if they're on a new estate, they can move that pin around as they see fit, and they can add building and entrance codes if they've got somewhere that's challenging to access for the driver. And then lastly, they get to review all of this content on one single swipeable screen, so that they can edit anything that they think is either incorrect or needs to change. And at the bottom of the screen, there's a little submit order, and then they go through the typical delivery dispatch process that we would see. And this has been a major success. So going on to impact, On the right-hand side at the top, you can see the kind of performance of our previous one-time link. So we had about 95% crash-free sessions and 2/3 crash-free users. On the bottom, you can see that the upgrade to that has been 100% crash-free sessions and 100% crash-free users as we upgraded the tool. So this is a significant improvement in the usability for the patients and in the performance overall of the tool. So additionally, through these enhancements and the changes to live delivery tracking, which I'll show you on the next screen, our first attempt delivery failure rates have fallen substantially by about 0.7% or 500 deliveries month on month. This live SMS delivery tracking, this also went live in May this year. So this means that as a delivery is going out to a patient, as it's through the dispatch process and on the van, they can see exactly where they are in the queue, kind of like you'd expect with any e-commerce provider. So they can see how many deliveries are before them, and they get an updated delivery slot as we progress through the day as well. Moving on to the second part of the timeline, which is the My HealthNet app and the patient portal. So as a secondary focus this year, after the on-time link was updated, we rebuilt the My HealthNet app and the patient portal desktop version. These products are in soft launch this week after rigorous internal testing, and the old systems will be switched off once stability is confirmed for the new tools. So a quick visual run through, I guess, of what these tools now look like. And you can see there's a bit of a switch up from how it used to be. So patients, when they log into the portal or the mobile app, they have what we'd call an action page, essentially a dashboard where they can see exactly what needs to happen and when it needs to happen. So the first change on this screen is you can see at the top here, we've got an active prescription button. So something that patients often fed back to us was they didn't quite know where in that prescription journey they sat. So whether a prescription was being processed, whether it was active and they needed to do anything, or if there was something else happening. So you can see here there's an active prescription and the patient is being informed that they have an order to confirm. Now, through user testing that we did with patients and internal users, they said this was much more discoverable than the current process. There is also a slot on this side of the screen on the dashboard for email or SMS updates when it's time to confirm nursing appointments. Now, obviously, this doesn't apply to every patient, but if a patient does have nursing, they go through a very similar process to what exists for orders. And this is just a mobile view of this same screen. Additionally, there's some discoverable cards at the bottom of the screen, which are updatable and kind of modular. So we've got welcome pack, user guide, and introduction video. Patients will be able to access these as and when they see fit. Once they access them, they'll go to the top of the page in their account. There's been some updates to patient messaging too, but I'll pass over to Melis for this one.
Thanks, Josh. Hi, everyone. Thank you very much for joining us today. So I just very quickly explain the new messaging channels that we have. So as you might know, we were sending messages to patients by SMS, and now we are going to change this system. We will be using another communication platform called Sandbird to do that. So what will happen is if the patients don't read messages sent through one particular way, then we send them to their next contact channel in the order of push notifications, which is the pop-up message that comes to the phones. And if they don't have the app or if they don't click on to open this message, then the next option is WhatsApp. Then the message is sent with WhatsApp. Again, if they don't have the WhatsApp app or if they don't open the message in a certain specified time, which in our case is 5 minutes, we set it up to, then the last resort will be SMS. So basically there will be 3 different ways to send the message to the patients. And this will allow us to interact with patients in the way that they prefer and change preferences in line with the individual rather than the system. Initial launch is planned for the end of September, and we chose 3 messages which are the most frequently sent for the initial launch, which is the one-time link that Josh described and order dispatch and order confirmation messages. You can see in the screenshot here the example how they will look like with WhatsApp. I mean, the content of the messages are the same as before. And you can see a screenshot of the communication platform I mentioned, which is the dashboard that we do the configurations for the order of the sequence of the messages, which is integrated with our internal system. That's it for this slide.
Thank you, Melis. Now, moving on to what I'm sure all of you are here to see is the updates to the clinician-facing tools. So on that timeline that we showed to you earlier, there is a planned update to the Clinician Gateway at the end of November after we migrate computer systems. Now, I'm hoping to show you on the next few screens exactly what that will look like for you, as I'm sure some of you are current Gateway users as well. So this has been, from my side of things, digital tools side of things, this has been the biggest project of the year for us. So this process has been undertaken with dozens of Gateway users from around the UK. We've been using focus groups and feedback sessions to guide the roadmap. So all of these things that you should be seeing should be guided, at least in part, by what you as users have asked for. Now, I'm hoping that some of you will be able to say, okay, great, that's something that I asked for. I think I see a couple of familiar faces on this call. So going through what you're going to see.
Oh, I see. It's on the screen.
I'm just going to mute you, Helen. Sorry. Cool. So this is what you're going to see when you log into the new Gateway. So currently, when you log into the Gateway, there's a dashboard page which doesn't really direct you anywhere. So the landing page that you see at the moment doesn't have any actions, doesn't have any things that you need to be notified of. It's very much a blank page. What we're going to change this to now is kind of a patient overview page. So within the same page, and this image pixelation is going to be problematic, but I'll run you through each of the columns. So you're going to see at a glance all of your patients, who they're registered under, what their status is, when they were registered, and then most importantly, what the current status of their deliveries is with regards to the current prescription. So say, for example, you generated a prescription for 2 deliveries for that patient, 2 installments. We can see for this top patient, Sam Smith, that they're on their 2nd delivery and it's currently in transit. And on the same page, you will see a prescription required by date as well. So we're hoping that putting all of this information onto a single page makes these key actions that you're taking as Clinician Gateway users much more discoverable and faster. Now, if you're after a little bit more detail, we've also overhauled the patient view screen. So currently within the Gateway, what you need to do is click on 3 buttons just to the left, and then you get a bunch of different options. Now, this wasn't particularly discoverable. It wasn't easy to use. And quite a lot of you end up with questions, how do I do this? How do I do that? Now, we're hoping that with this overhaul, all of these questions will be able to be kind of self-guided in terms of, okay, I can see the current prescription status here. I can renew it if I want to. I can see the current order status and the proof of delivery. I can see the KEF for the last nursing appointment and what the status is. And on the overview screen, I can see how HealthNet have been communicating with that patient or how that patient has been communicating with HealthNet. Now, from the sessions that we've run with you, we think this is the key information that you're after seeing at a glance. There might be some exceptions for some users, but we think this is covering a lot of the use cases. Now, to go through some of these tabs at the top of the screen too, if you want to go into a bit of a deep dive on prescriptions and orders, you can see the current prescription and the orders that are attached to it within this screen. Communications, you can see a greater number than 3. You can see all historical communications that patient's had with us. Nursing, same sort of thing. All the past nursing appointments, statuses, and KEFs. And then patient details and management, you'll be able to see what the patient's registered under, what their status is, be able to change their status with a single click, and to see. So something we get asked by a lot of you is, okay, I want to make this patient eligible to use the portal. You'll be able to have a look at that as well. Now, going into the second element of the kind of changes to the Gateway, and this is a big one, we are merging with the patient demographic service. We're using an integration to allow you to register your patients with us using the PDS. Now, this should reduce the amount of manual data entry that you have to do per patient by up to 80%. There should only be a few fields that you have to fill in per reg form. So by using date of birth and NHS number, that data should be able to be imported, and you only have to fill in a few core details for that patient to be registered onto home care. Now, we do still offer the option to use that manually if you don't want to use that. We think that the vast majority of users will find this top process to be much easier and faster and safer as well, reducing the risk of user error. Additionally, if we go back to this screen, you can see on the overview page, there's a button to renew prescription. This is a relatively similar function to what we have in the current Gateway. We're just hoping that this journey has become slightly streamlined and more discoverable for you. So by clicking renew prescription, all of the information that is to do with that user will be pre-populated, and there should only be a couple of key elements for you to fill in with regards to that specific prescription. For example, dose, frequency, and duration. Now, going on to this next section, prescription management is something that a lot of you ask us about. Now, prescription requesting is a separate piece, so we're not going to touch on that directly, but what we are going to touch on is how you get prescriptions to us. There are quite a few ways that prescriptions currently get to us as a business. So we have what we call the traditional route, which is a prescription that is either emailed or mailed to us. And the processing time for this is slightly longer due to mailing, post times, whatever it might be. You have e-sign prescriptions where prescriptions are generated as templates for you. You send them to us. you can send them out for e-sign, then they go to our pharmacy, or you have prescriptions that are generated through the gateway. We're looking at making this process easier for you as gateway users so that your time spent processing prescriptions goes substantially down. So there are 3 phases of work that are being completed for this. So the first phase is single prescription upload to the gateway. This has been completed. We aren't, however, planning to launch this to users until the second phase is completed too, which is the upload of single prescriptions and using OCR to pull data from those prescriptions. Now, what this means is that when you upload a prescription to the portal, all of the core data that exists within that prescription will be pulled into digital fields that can be reviewed by you for a confidence level so that the time spent processing prescriptions for you and for our teams goes down substantially. Now, lastly, the golden standard for this is phase 3, which is the bulk upload of prescriptions, and something that I'm sure a lot of you have asked your BDMs about. This is currently in progress, and this is planned for delivery in December this year. And this will be the same as phase 2, but just being able to upload multiple prescriptions at the same time. Now, on the next few screens, I'm planning to show you a few different concepts that we've got for this. Now, bear in mind that these designs are contingent to change. They are first drafts of concepts, but it should give you an idea of the functionality that we're discussing. Prescription batches. So here you can see what we're trying to visualize is the status of the review screen of the current prescriptions that you've just uploaded. Okay, so you can see the batch of prescriptions that you uploaded, where it was uploaded to, what the urgency is, status, and the number of prescriptions that sit within it. Any actions that are required for you, which will be dictated by the confidence that the OCR model has in pulling that data from the prescriptions, can be seen right at the end here. Bulk upload, when you go into those individual prescriptions, you'll be able to see the uploaded document and the fields that we've pulled from them as well. So you can see here's an example of an uploaded document. This is fake data, and you can see the data that's come from it as well. And this can be reviewed in accordance with whether you think it's incorrect or correct. Anything that has a confidence rating of below a certain threshold, I believe it's 50%, will be flagged for your review, regardless of whether it's kind of right or wrong. We need this system to be safe. We need this system to be consistent. And we think that's the best way to do so. Now, because this is yet to go into launch, kind of deriving quantifiable impact at this stage is difficult. But here's what we're expecting based on the user testing and based on how the development process has gone. So, like we discussed earlier for the patient portal, information is more discoverable. Quite a few of you have questions, how do I do this in the portal? How do I do that within the portal, the gateway? Now, all of these steps, you should be able to get from one step to another with that kind of self-guiding, in-context learning tooltips that tell you how to perform a process without you needing to perform a bespoke communication with your account manager. This makes it easier for you, makes it faster for you, and essentially it reduces the number of emails that we have to send to each other. So less time for key actions. Registering patients, as you saw from PDS integration, that time should go down. Creating prescriptions, prescription renewal, bulk upload, this time should rocket right down as well. Changing patient statuses. Now, I didn't show you a screen for this because there's, I can show you a million screenshots of this gateway. You'll be able to see it in December properly. Changing patient status will be able to be done with a single button rather than going back into the reg form, choosing a status, submitting it. Now, this seems like a negligible thing, but if you're changing the status for 10 patients, that time goes down from 5 minutes to about 30 seconds. Processing and querying invoices. Now, I've put a screenshot of this on the right-hand side. When we've been running gateway testing with you as users, we've had some feedback on the invoice screen that, it works. People have adapted to the limitations that our current system has, but really we want this system to work for you rather than you needing to adapt to what our process is. So we made a few changes in terms of invoice status, what's the amount remaining, how much balance is overdue, how much balance is outstanding. And then we've also put in purchase orders number on the same screen as well, which is how a lot of you identify prescriptions too. There is also going to be enhanced invoice querying so that you can see the current status of any queries that you've opened through the portal. And that should reduce the amount of time that you need to go back to emails. You need to email us to say, okay, what's the status of these queries? Essentially, everything becomes kind of slicker and in one place. As you're probably getting the impression, navigation being easier has been front and foremost. Better error handling and field validation. Now, the best way to prevent errors is to stop them from being entered in the first place. So with better error handling, we think we can do that. Built-in user tips, we talked about this within context learning. It should essentially allow you to get from one step to another without having any questions about how some functions work. And as you've probably seen from a few of the screenshots, we have RAG-rated statuses across screens so that you know exactly what's priority and you can see the information that you need to look at first. Sorry, the screen is a little bit heavy on icons. I think I went a bit heavy-handed on it. But what's changing? All core user flows optimized, patient reg improved, single patient views enhanced, improvements to invoices and credit notes, easy repeat prescriptions, and prescription uploading and OCR. What's next? Now, we put a timeline for kind of 2025, Digital Tools 2025 roadmap. And this is what's to come after this. So bulk prescription upload towards the end of this year, summary care record connection, having data about your patients in a single place rather than having to consult between multiple systems. This makes kind of information about patients centralized and easy for you to see. Live web chat powered by Genesys. Live web chat in this sense is referring to your ability to ask questions about the gateway without needing to open up your emails and get in touch with your account manager. You can go to a query team, you can have your query answered within a few minutes. Done. No need to wait a few hours. And then lastly, this is to come between Q1 and Q2 next year, enhanced reporting on e-sign and analytics. Now, this could be the number of e-signs you send, the current status of e-signs in terms of a dashboard, which prescriptions are being waited on, what's their current processing time, and you can kind of see your volume and start to see how that prescription journey is changing for you as a trust as well. I'll hand over to Sean.
Thanks, Josh. I've been watching the comments as we've gone through this webinar, and there's a number of comments around what happens to patients that don't have smartphones? How are they going to interact with us? And really, what we're doing with our customer service is that we recognize that all patients are unique, that they've got preferences as to how they like to interact with us. And obviously, they've got different tech in their home, etc. So what we're trying to do is not impose one way for a patient to interact with us. It's to say, how do patients in this modern world interact with us as a provider? Some people prefer phone, some people prefer logging onto a website, some people like web chat, some people like WhatsApp. Everybody has a preference, and we as a provider have to meet that wide range of ways that people want to interact with us. So in order to, I suppose, augment our capabilities, what we've done, we went to market and we selected a system called Genesys. It's a tier 1 contact management solution, and it allows us to bring all of those channels together. And why is that important? It's because a patient doesn't always choose the same channel. Sometimes they might use a web page, sometimes they might use a digital device, sometimes they may call up. But what they need to see is that their query is being dealt with in the same way. So no matter what communications channel you're talking to us on, this brings all the channels together and it measures and tracks our interaction with that patient. What that means is we don't have emails going into black holes. It means that everything is tracked. It's all part of a channel, and we're measuring the performance of those, and we're making sure that we're responding promptly back to our patients. Okay. So we're well advanced in our implementation of Genesys. What we're doing at the moment is building things like the automated call distribution to make sure that we answer the phone calls efficiently and that the right people are answering those calls who are able to answer the specific queries that either a patient or a clinician has. We're doing intelligent triage, we're queuing the patients, we're routing calls, and we're also providing people who don't have a digital device the ability to interact with our digital agents. For example, out of hours, when is my next delivery? Getting a response back in a timely manner, rather than having to wait until a call agent is available. If you want to move on, next slide. Okay. So the key elements of Genesys, we have some digital automated agents. They operate across all these digital channels and they interact with our back-end systems. So that includes things like web chat, messaging platforms, so Facebook Messenger, WhatsApp, or SMS. And what they enable us to do is to improve our self-service capabilities to our patients, and they're able to answer frequently asked questions without needing to wait for a human agent to intervene. We also have voice automated agents, and they can enable automated speech-based interaction. So what that can help us do is validate the caller to make sure that we're routing them the right way. We're validating their inputs, and it means that we've got more capability to use live agents talking to people who need the support of a live agent. Next slide, please. Okay. And again, one of the key differences of this is that it is persistent asynchronous conversations. So no matter what channel you interact with us with, when you connect back into us, the complete visibility of the conversation that you've been having with us through that other channel is available. When a call agent picks up a call, there's a complete history there of all interaction with the patient or with the clinician. And it allows us also to configure the channels to best respond to our patients. We'll be continually monitoring all interactions on those. We'll be learning from the messages and the language that we use, and we'll be adapting that to make it as effective as possible in communicating with the end patient. Okay. So I think that's all we're going to cover on the customer service improvements. So moving on, computer system change. And I understand when you hear computer system change, immediately alarm bells start ringing. Oh my God, what is that going to mean? Is health going to fall over? All of those kind of things. So let me talk you through it for a minute. So the package that we've been running is one from Microsoft. It's called Microsoft Nav. Nav was paused in terms of enhancement by Microsoft since 2018. And what Microsoft did is effectively rebadged it and called it Business Central. And they added extra capability into it to cater for things like cloud access and so on. Now, the approach that we're taking, it's completely tried and trusted. Thousands of organizations have followed the same upgrade path from Nav to BC. And what we're doing is, rather than implementing the system from scratch, is that we're doing a lift and shift. And that's a really key thing that we're doing. What that means is the process that is working and tried and tested at the moment and validated and so on, we're taking that process and we're just moving it across to BC. Works in exactly the same way. Our staff have been involved in the process all the way through. We've now successfully completed a trial upgrade, so we know that this will work. We're going to go live in early November. At the moment, we're working through the validation of the system, and then come November, we'll simply remigrate the data across, but already we have a working system. We have our users testing it, going through all of the flows, etc. So it's really important for us as a business that there is no impact on our day-to-day operations through upgrading the system. And you might say to us, well, why are you changing your system? And it comes back to the key point that Microsoft has stopped developing Nav. So in order for us to add new capability into our digital tools, to improve our processes more, we have to make this move. But really, I want to reassure you, we have taken every step possible to make sure that this will not have any impact on our operations. Okay, so following through on that point, how do you manage change? How do you resource change? How do you ensure that we've got a smooth go live? So we're working with experienced partners. They've been through this path many times before, whether it's an upgrade of Nav to BC, or whether it's an installation and working with us on digital tools. We've gone through, we've risk assessed all stages of the process. We have full plans and scenarios for all kinds of occurrences that could, no matter what the small likelihood of it happening, it's part of a risk assessment. You've got to put all of your mitigations in place. And as a result of that, as I said, we've already gone through an upgrade of our core system, and we are in the process of fully testing that and validating it, etc. So again, to reassure you, we have taken every step possible in terms of this. And in order to resource that, what we did was we increased our systems validation team and we increased our testing team. And Melissa is going to talk later about some other measures that we put in terms of how we are testing all of our systems. Now, as part of our mitigation plan, what we're also doing is we're temporarily increasing our customer service and our operational staff to ensure that there's no impact to you or to our digital tool users. Okay, I'm going to pass back to you, Melissa.
Thank you, Sean. Yeah, as Sean mentioned, we are improving our testing process. We started working with a tool called LeapWork for the automated testing. And this is a codeless automation platform, which is using visual flowcharts like you see in the screenshots there. This will be accelerating our test creation, execution, and maintenance, and increase our test coverage and speed, and there will be reliability across our applications. We are at the moment building test scripts across all our digital tools and also our internal systems, for instance, Business Central, as Sean mentioned before. So yeah, we are hoping that this will be helping us covering all of the possible scenarios and help us do end-to-end testing using LeapWork. Yeah, so we are very close to starting to work with it as close as this month, hopefully. Yeah, so that's all I have. Thank you.
Great. Sam, I've been watching some of the comments.
Yes.
So let's jump into to some of them. So there's a number of questions really around business continuity. There's questions around validation, DTAC approval, etc. So let's split those out. So we have a systems validation team. All of our systems, or all of our systems that deal with our medical or clinical data or prescription management, all of those systems are validated. And we will not introduce a system until that system has been validated. Any systems that we develop in-house, we develop to all NHS standards. So we're talking DCB 0129, we're talking DTAC ready assessment, we're Cyber Essentials Plus accredited, we're DSPT approved. So all of those things, we will not develop something that is not compliant, that is not validated. And that's why I'm capable of saying to you today that we have gone through already and we have built our new VC system and we're in the process of validating it. So that's why we know that this process is going to work, because we've already done it, because at the moment we are testing the system and we're validating it, and we're giving you the best indication in our plan that we're on track for go live in November this year of that system, which is validated, which is completely tested. And as Melis has said to you, we now have an automated testing platform. The advantage of that is that any time that we make a change to our system, we're able to run through a gamut of automated tests, testing across multiple data entries, multiple points of entry into the process. It will work through, it will give us a pass and fail, and it gives us an evidence file to evidence the tests that have been undertaken. And an automated test system, the advantage of it is that it runs 24 hours a day, 365 days a year. So it makes sure that we can continue to be innovative, launching new capability to meet your needs while ensuring that we have tested and validated that system so that it stays compliant. Okay.
Thanks, Sean. I think some of the questions that have been posted probably were answered. So I'm just going to quickly go through them. There was one question from Ruben saying, can you explain the one-time link? I think, Josh, you covered that off in the presentation, but Ruben, are you happy with what Josh covered, or is there anything outstanding with regards to the one-time link and what it is?
Yeah, it was just, how it was issued to patients. How long does it stay valid for, until the patient uses it? And what does it actually entail? And Josh did cover a little bit of that in his reply, my comment, in the chat function. But certainly, as far as how is it received by a patient and how long does it stay valid for until the patient uses it?
Could someone help Ruben with those questions?
Yeah, if I jump in here. So we have a process of sending reminders out. So those requests to confirm your delivery go out to a patient. A patient then has the opportunity to use any of the digital tools, and so they can log on to the patient portal, for example. Sending them a one-time link is a way for a patient to more efficiently log in to complete just that task. So rather than logging into the patient portal with their CT number, etc., the one-time link is sent to the patient and there is data that they need to confirm, which then lets them in to only confirm the delivery. It doesn't allow them any other access to their broader HealthNet account. And we find that many patients prefer that because what patients want to do is efficiently confirm their delivery in in the least time possible. So again, if you make something easy for somebody to do, then they will go and undertake that task. If it's a difficult thing to log in and to confirm the delivery, then patients won't do it. And then what happens is that we have to hassle them by calling them again and again to get them to confirm. So digital tools are based around patients' behavior and their way of interacting with us. To specifically answer your question, that digital link stays open until the order is confirmed. And if it's not confirmed, either through the patient portal, through the one-time link, or through a customer service agent ringing the patient, then the link will stay open until we successfully reach that patient and manage to confirm through one of the channels. Once we do, then the link is shut down.
Thank you.
Okay.
Got a question from Alison. Are there any restrictions as to when patients can request next delivery and what mechanisms are in place to stop them over ordering? Is that something that we can answer in this call, or do we need to take that one away for the operations team?
I think operations are here, they can certainly answer it, but I think it's better if we focus on the digital elements as part of the webinar today.
Alison, I'll get that response to you in a follow-up email. Raghu, can you please confirm if this is available to the entire country? I think we've answered that already around the ordering. I think we've answered the query about the pushing out the 3 types of messaging. We've answered the question about elderly patients because we will contact those patients through our patient support team. I think we've covered quite a few of these. Can the patient prefer a choice for that time and for future? So that one's come from Raghu. He's got his hand up. Raghu?
Can you hear me okay?
Yeah, I can hear you now.
Perfect, thank you. My question was, if a patient was preferring only a text message rather than WhatsApp or an app push notification, if they preferred that the first time and for the future, can that be a choice? Because if you're trying it for three different ways, and if a patient's actually already chosen the method of communication with yourselves, and if you're sending the same message on 3 times or 3 occasions, then it's more of a chance that the patient can ignore your messages completely.
At the moment, at least for the first launch, we don't give them the choice, but we are thinking of that possibility for the future. But that's a good point. Yeah.
Just to build on that answer, so the software has the ability to set by user the preferred communications channel. What we haven't built yet in the digital tool is the ability for the user to choose that. So at the moment, what we're doing is we've built a standard flow for everyone, but the capability is there to switch the configuration of that on in the digital tool. We wanted to get that out there as quickly as possible to as many people, and after it's in place, then we'll look to fine-tune the user's ability to control that. But I think it's a really good point. Thank you.
I think, Linda, we've answered your question. Waiting all day or more precise time, and Sean's come back to say initially there's an AM or PM request by the patient. That's followed by a 2-hour window the night before, and then they will get their SMS tracking saying, giving a 30-minute window. There was a question from Raghu about PDS process linked with NHS Digital, and I think, Sean, you've confirmed PDS is an NHS digital service. There's a query around registration form. If we upload a registration form, then the OCR will read any template. Yes, that's correct. You will also see a copy of the prescription. I think that was a query as well. So you'll see a copy of that prescription within the gateway. Will prescription upload read the PO number too? There's a thumbs up, so that's a yes. Gemma said we're expected to check the prescription. So I think what Gemma's saying is with other providers, they upload the prescription and that's it. The provider checks the prescription. There's 2 thumbs up here. So
Sam, if I can take that again.
Yeah.
So nothing changes in our standard process. So at the moment, when you send us a prescription, whether it's on paper or whether it's a digital or e-sign prescription, it goes through all of our checks within our pharmacy before the order is confirmed on the system. What we're doing here is that when you upload a batch of prescriptions, we're also giving you, because you're the originator of the prescription, the ability to check that data. And we are highlighting for you the areas where we feel there could be concern. And you as the originator are the source of data. So we think that it's right to give you the opportunity to change that. But at the back end, it is still going to go through every single prescription check that we currently do at the moment before we will raise the order and deliver the product to the patient.
So that's optional. We don't have to do that check.
No, you don't have to do that check, but we are, highlighting a concern, and we will, as I said, we will go through all of our normal checks on that. We take AI and OCR and everything else very, very seriously, and we believe it's the right thing to do to give you the opportunity, but you can also,
Let me just jump in, Sean. I think,
Sure.
No, you don't have to do that check. What it'll do is we'll scrape the data, and if there's any any kind of questions around the data that's been scraped, that it's not clear, then as with any other prescription, we'd come back to you and go, patient name's missing. Can you give us that? Or, you know, whatever field that we think that is incomplete, we'll come back to you with that query. You won't have to review all of them. It will simply be the ones where we can't interpret the information that's on that script.
Yeah, that makes sense. It's just for us, we use so many different home care providers. It's really difficult to have a separate workflow for every home care provider that
Absolutely get it.
Upload it to the portal. Obviously, that's slightly different, but doing a whole different workflow for every home care provider is quite tricky.
Yeah, I'm trying to minimize the impact to all of you, and effectively you'll get, if there is something that's not clear, it'll just be flagged as it is now.
Thank you.
We appreciate that, Gemma. You're working with a number of different portals and logins. We know how complicated it can get for the home care teams. Another question here about having full visibility of communications made with patients. Yes, that's correct. You'll be able to see all the communications and interactions that take place with patients when you're on the portal. What is your business continuity plan? Will that be available to the NHS? So I think, Sean, is that something we will follow up on and send out to the attendees today with regards to our continuity plan?
Absolutely happy to make it available to people.
Super. You've touched on DTAC already. Mark has asked, when bulk uploads are in effect, if I upload 12 prescriptions and the system accepts them all as readable, will I receive a confirmation email on the same wavelength? If 2 of those 12 weren't available to read on the system, will I receive an email telling me what action needs to be taken for these 2 prescriptions?
I've responded to this one in the chat, but the gist is that I said that's a good flag, Mark. We were going to notify users through the gateway, but we can also introduce emails to back it up. 1 email per batch would work well.
And sort of on the same topic, if patients are being registered and prescriptions sent via the portal, do they need to follow that up with a hard copy in the post to HealthNet, or can they just keep copies themselves for archiving?
So on this, effectively the agreement will be by trust as to what you would prefer us to do. So whether you want to send us the original copy and we'll keep that, or whether you want to keep the original copy, but it is a legal requirement that the original is held.
Yeah, and we've currently got a pilot ongoing where we just have some documentation that's approved by a senior pharmacist, chief pharmacist, and that is exactly as Sean says. Either the trust will store and archive the hard copy wet signature prescriptions, or they are sent in archiving envelopes to HealthNet and we store them on your behalf. But we only would open them if there's an audit purpose or a query that it means we have to look at the actual original copy. I'm just having a look. Mark's also commented around a long-term issue regarding gateway and prescription requesting not matching up. Has this new gateway been tested to ensure prescription requests sent by email and this gateway will pull the data from the same place?
I responded to that one just below it.
Okay, yeah. So the standard gateway reporting and the SUP discrepancies in internal gateway reporting have been realigned. Okay. If a patient arranges a delivery but would like to rearrange, do they have the option to do this via the same link that was originally sent to them, or via the link where the delivery has been confirmed? I think we're asking if it's already been booked, what's the best way to rearrange that?
Just below again, so they can change certain elements until it's in transit. Ancillaries address is until the order's in pharmacy. Signatories is until the order is in transit. And then there's a new function coming where they can postpone it, which essentially cancels it and asks them to reschedule it until 6 p.m. the day before delivery. And then there's another question, which is, can it be done via the original link, which is yes, until the order is in transit or via the portal or mobile app, or they can still contact CS or contact us by email if they don't have a smartphone or digital device.
Thanks, Josh. So I think you can see by all the questions, there's been a lot of engagement. Hopefully, I know there's been a lot of information that we shared with you, but hopefully it's given you a window into what's been going on at HealthNet to address the feedback that we've been having ongoing for the last 18 months. We will go through the questions and get up. We'll ensure that there's written responses to you, and we'll get those sent out along with the recording and the slides today. I think there was just one more question that's suddenly popped up at the last couple of minutes. Will invoices be visible on the patient screen? That's from Evelina.
And the short answer, which I was just typing, but you beat me to it, Sam, was yeah, this is something that was flagged to us in user testing. Unfortunately, the data doesn't quite match up that nicely because we're going from kind of SOs and stuff. But this is not going to be for MVP. It is flagged for early next year.
Thanks, Josh. So we are finishing, I'm glad to say, because I know you are very busy people, we'll be finishing on time. If when we've sent out the materials from today, you've got any more questions, please send them either through, probably best send them to myself, and I'll cascade them to the team that presented today, and we will get responses to you as soon as we can. Firstly, I'd like to thank all of you for attending today. As I say, I know you have very busy diaries, and we've had an excellent attendance, so really, really pleased with that. But also I'd like to thank the team that have joined us from HealthNet, so Josh, Melis and Sean, for presenting today, and for simplifying what can be really, really technical information. So thank you very much, and have a good rest of the day.
Thanks, everyone.
Thanks all.
Thank
you.
Bye.
Thank you very much.
Bye.